Well, thank you very much and good afternoon. Welcome to Community Comment. Our guest on Community Comment today is the Chief Administrative Officer with Marshfield Medical Center, Beaver Dam. We want to welcome into the conversation Angelia Foster. Thank you very much for joining us today.
Thanks for having me. I appreciate it.
So the reason we're sitting down and having this conversation today, it's somewhat obvious. It's because of the pandemic that's going on and the stresses that we're facing in the healthcare industry nationwide, and unfortunately, right here in the city of Beaver Dam in the Dodge County area in the state of Wisconsin. I just want to start the program by asking how you're doing, how your staff is doing, how's everything going over at Marshfield Medical Center?
Thank you for asking. It's a pretty stressful time. I will share with you that we spent the spring and the 7 months since then really focusing in on how to prepare best. And so the team has done a great job. We're ready, but I will tell you it's very taxing. On any given day, 20 to 25% of our staff are unavailable to work, either because they're COVID positive or they're a close contact of someone who is. We're doing that while having an average daily census that's 160% of what we normally carry at this time of the year. So we're doing 60% more work with 20 to 25% fewer people here to get the work done. And it's hard on the team. COVID patients are a different kind of patient than we traditionally manage in rural health. They have greater needs. And it requires, full PPE for hours on end for the staff. And so they are exhausted, but committed to doing what's right on behalf of our patients and continue to show up every day and do their very best work on behalf of Dodge County.
75% staff is basically what you're working with at this point. What
Yes.
how is their morale? I know you touched upon that, but can you elaborate on that a little bit more for us?
I think that they're tired, just like we all are, right? We all wish we could go back to the life before COVID. But the hard part for healthcare is we're here because we've been called to it. It's not an industry that people jump into lightly. They come here knowing that they're going to help the very least of these, many times folks who are very sick. But I will tell you that I look in their eyes, I see a lot of pain. I remind myself in places like Dodge County, they're caring for their friends and their family. They are looking after their kid's soccer coach or their mother-in-law's best friend. And so they're taking care of people on the floor that they know who are really sick, sometimes recovering and sometimes not. And so that's taxing on the staff, who are very talented and very competent, but it's still emotionally very draining for them. And then add the complexity of at home, their life is just as complex as all of ours related to COVID. So they're not sure if their kids are going to be in school. They're not sure if that runny nose that their child has is a runny nose or COVID. So there's lots of complexities and stress bearing down on them. And the hard part is then to hear people who don't believe that it's real. It is very disheartening for those who see how real it is.
And that may be a whole conversation, and maybe one we'll get into a little bit later. There does seem to be some questions by some members of our society about what it is you guys are doing. But I imagine a simple review of the hospital facility and what you guys are going through on a daily basis would go a long way to address something like that. What do things look like in the halls of Marshfield Medical Center, Beaver Dam, here on a given day now in November of 2020?
Yeah. So we have, right, some days double occupancy, what we normally have. And the flu season is October through late March, early April. So we're normally busier at this time of year, but we're 160% above where we normally are, right? And so if you walk down the halls, you're going to see lots of PPE stations. You're going to see staff coming out of rooms sweating through their clothes with full PPE on, needing to change where they go into the next room, trying to help the folks in the room who, the loneliness that exists for those who are well trying to recover from COVID, right? Let's say they've been here for a period of time, a few weeks, and they're getting better, but they've also not seen their loved ones. The only contact they're getting are from these remarkable members of our team. who are doing their very best in very trying circumstances. And so I would say it's a very different experience than most people have had in healthcare. When you come to visit a loved one, it at times feels like a war zone. And I'm really grateful for the teams that continue to show up and do the work, and are trying their very best to do what's right for every patient, but it's very taxing.
These are people that got into healthcare to give something back, to do something for their community. Can't imagine anybody would ever have anticipated a turn like this in their careers.
Correct. What we're really trying to help the staff to see is, first of all, we want to talk about it, right? We don't want to walk away from the post-traumatic stress that they're facing every single day. This is not the job that they signed up for originally, but they will rise to the challenge and continue to do so. I think the thing that I try to remind myself is they were called to this work. And so when you're called to this work, you know what's at stake for people who walk through those doors and need that level of support. But it is disheartening when you go to the grocery store or you stop on the way home to get a gallon of milk and you're in your scrubs, right? My staff will be in their scrubs and they're going into the Quick Trip or wherever. And people are saying, thank you for all you're doing, but they're saying it without a mask on. And what my staff shares with me is they don't understand. I'm safer at work than I am stopping to get gas on the way home. Because at work, we use PPE. We have our mask on. We maintain social distance. We fully gown up before we go into a room. But in our communities, we're not getting that same buy-in and commitment to how do we prevent the spread. It's by using masks, social distancing, not having large gatherings, washing your hands, and getting your flu shot. Those are all things that individuals can do. But for the staff, it's disheartening when they see so many in our community who don't seem to understand that.
And that is the very type of thing, I imagine, that feeds into burnout, which we're hearing about in the news. We're hearing about healthcare professionals quitting, leaving their jobs, putting it behind them, doctors.
Yes.
Who've, gone through medical school, nurses who've put the time in, suddenly just saying, I can't do this anymore.
Yeah. And I think, healthcare, we have a shortage anyway, nursing wise across the country. This is the year of the nurse 2020. And so we were looking forward to really celebrating that incredible work that our nursing teams do. But across the country, you're seeing a shortage. And I am very concerned that the lack of support, the lack of buy-in from many in the community will create a moment where some of our staff make the decision to leave. I can share with you today, we had 3 resignations in the last 24 hours of staff that I really don't want to see leave our organization, but I understand they're tired and they're burnt out and they're overwhelmed. And it's hard to face what they're facing when they don't necessarily always feel the support that's needed to sustain it. So I do worry that we will have huge turnover issues in the next year. They're working harder, they're doing more shifts, they're taking on greater work. They're doing all of these things to try and take care of our community, and I need our community to step up and take care of them.
920-885-4446 is the phone number if you've got a question for Angelia Foster. She is the Chief Administrative Officer with Marshfield Medical Center, Beaver Dam. Again, that's 885-4446. We're seeing this surge in cases in our area. We've been hearing now for a couple weeks that your facility, Marshfield Medical Center, is at upwards of 90% capacity. What does that mean? Explain that for us, if you would. In the reference that you just made to 3 healthcare professionals in the past 24 hours resigning, does that change capacity? Is capacity just about bed space, or is that a combination of bed space and staffing? What do things look like right now as far as that's concerned?
So we've been at times up to 90% of our capacity, and that's after adding an additional half a wing. We took a wing that had closed a few years ago. We've activated it in order to meet the community need. And so we're at times at 90%, and then of the 90%, between 60 and 80% of those are COVID positive patients. So it means folks who need to have their knees replaced or their hips replaced, we've had to cancel those surgeries and postpone them to another time because we don't have a bed for them to recover in should they get that surgery. So we've reduced our surgeries significantly. We're still doing some and really working on the emergent situations where people have very specific needs that they need to have surgery for. In terms of staffing, right, I shared with you 20 to 22, sometimes as high as 25% of our staff has been unavailable to us. And so when you start to see some of the turnover concerns, I have grave concerns for our ability to provide all the services that we want to the community. We want to continue to be a place you come to get care, but we've had to reduce our surgeries. We had to reduce our sleep lab capacity. We're looking at every clinic every day to see where we can pull resources from in order to meet the needs of those who are on the inpatient unit and in the ER who are really struggling and need that additional support right now.
920-885-4446. Again, the phone number if you've got a question for Angelia Foster. A small technical issue that we have, I may have to relay your question back to Angelia because she might not be able to hear you. But if that is the case, we'll just soldier on ahead, and I'll do my best to keep some notes here. So we'll go to the phones and say, good afternoon. Welcome to Community Comment. Thank you very much for that question. That's certainly one I might not have ever anticipated thinking to ask. And Angelia, you weren't able to hear that. Apparently, the caller's question basically involved those with a COVID diagnosis who are experiencing symptoms, people who are sick, who are afraid to go to the hospital because their loved ones might not be able to see them. That may be the last time, quite honestly, that they may be able to see those loved ones. What do you have to say to those people who are afraid to go to the hospital?
Yeah. Well, first of all, I think we have to be honest, right? We're all a little afraid right now. But if you're sick and you're showing symptoms, please call your primary care doctor. And if you don't have a primary care doctor, we would welcome you to come see us. Our urgent care and our ER are available to help those who need to be seen. And we do our very best. We have put in visitor restrictions. That's to try and keep as many people safe as we possibly can. I will share with you that if you are at the end of life, we do allow visitation with one person. We don't want folks to pass without their loved one. But we also have taken extra steps. So we have iPads available in the room. The staff will make sure you get connected either via iPad or the telephone so that you can talk to your loved one as best we can facilitate that. And so I think that there are reasons to be concerned, but we want you to come here. We're safe and we want to look after you and we want to do what we can to mitigate your circumstances. So please know that we'll do our very best to find ways to accommodate unique and different visitation, but we understand the fear.
There are also people out there that are that may not be experiencing any symptoms, that may not have COVID at all, but may have other health issues at this time. What is the message to those people who may need to go in for a routine checkup, that may need to go in for an elective surgery, who may need to do something a little bit more serious?
Yeah. So I would always encourage folks to reach out to their provider, right? Either their primary care, if they're someone who sees a cardiologist or someone who sees a pulmonologist, reach out to those folks. My grave concern for folks is that we don't want to put anyone at risk. And so we're trying to leverage telehealth as best we can as well. And I can tell you, my husband got the chance to use it. He was a little bit, not sure that it was going to work. And he said, it actually worked really well, honey. They were able to look at what was wrong with me and help me figure out, he's high risk. He has some immune issues. And so it was a way for him to still see his doctor, and get the care that he needed without having to come on campus. But that's also a conversation, right? When you talk with your provider, if they believe you need to be seen in person, we want you to come in and be seen. And we're screening at the door to make sure we're trying to eliminate risk for folks. We do require a mask. We ask that you practice social distancing and safe hand hygiene while you're with us. But if you need to be seen by a provider, we want to make sure that happens as well. But I would always start with the phone call. And if they suggest telehealth, try to be open to it.
All right. Thanks for that call again, 920-885-4446, the phone number if you've got a question for Marshfield Medical Center Beaver Dam Chief Administrative Officer Angelia Foster. We talked a lot about flattening the curve back in the spring, Angelia. Is that still a relevant term? Is that something that's still important, something that we should be keeping in mind nowadays?
Yeah, so I would just take a bend in the curve, right? Right now, it's on a pretty straight line trajectory up. And so I always share with folks, I think it's important. In the first 7 months that we managed COVID, we had 1,500 people in Dodge County who were impacted. Today, we have over 6,500. In the last 30 days, we've had 34 new positive cases in Dodge County. So we're not flattening the curve. We just have to try to find a way to bend the curve because I think if we bend the curve a little bit, it gives the healthcare workers the reprieve that they need to be able to be refreshed and ready for the next wave. I also think that it helps us all to just be mindful, right? In the first 7 months, we only had 9 deaths. Right now, we're up to 53. And so we need for folks to focus on we can't totally flatten the curve, but we could certainly bend it in a way that helps protect more people and helps to allow the healthcare resources to have that little breath in between some of the rough days that we're facing right now.
Is there anything that the public can do? I mean, obviously we talked about wearing a mask as the very minimum of decency and respect that we could show for our healthcare workers. Are there other things that we can keep in mind?
Yeah, so I'm a mom of 5, and Thanksgiving is a really big deal for us. I'm going to tell you as a community, we need you to limit your Thanksgiving activities to those in your immediate household. That's something everyone can do, right? I would love to have all of my kids home. But this will be a memory someday where we talk about the Zoom meeting we had as a family and where we shared our new recipes and had table talk on a TV instead of in person. So that's something everyone can do. Try to mitigate those circumstances where you're in large groups. Wear the mask. I hate masks. I hate it. I like to be able to see people's whole face and look at them and smile. But I also know that they work. And if they didn't work, we wouldn't have spent the last 100 years in healthcare wearing masks to keep you safe when we perform surgery, right? We would have just said, okay, you don't have to scrub, you don't have to wear a mask, we don't have to mitigate any of the infection risks that come along with surgery. So wear your mask. Wash your hands. I would say an average person needs to double the amount of times they wash their hands and avoid touching your face. That's how the virus makes its way in, right? So be careful of that. Get your flu shot. The symptoms of COVID and the symptoms of the flu are very similar. And so if you've gotten your flu shot and you're still having some of those symptoms, it's a better indicator for your provider to know where you are from a symptom management perspective. And then lastly, social distance. It's kind of going back to some of those things we learned in kindergarten, right? Not everyone wants to be as close. And so if you can stretch your arms out and touch them, they're too close. You should be able to put both arms out and have a wingspan of about 6 feet in order to keep each other safe. And so those are things that people can do in the community and stay home. That's the other thing. If you don't feel well, don't go to work. Even if you think it isn't COVID, you just think it's a cold. We don't know for sure that it isn't, and we need for everyone to do their part to try to protect each other.
And we'll go to the phones here. Before we go to the phones, though, real quick, you can get the flu and have coronavirus at the same time. Is that possible?
Yes. Yes.
Okay.
I think this season will be interesting to see what happens. I can share with you that an ER provider from last year said COVID was probably in our community before we knew it because of quite a few number of folks that we tested in the ER for the flu tested negative, but their symptoms were so similar that we believe it was probably COVID in retrospect. So this will be a learning year for us relative to the flu and to COVID. but you can have both symptoms and you could potentially carry both viruses.
920-885-4446, that phone number if you've got a question for Marshfield Medical Center Beaver Dam Chief Administrative Officer Angelia Foster. We'll go to the phones and I'll translate the question again and say, good afternoon, welcome to Community Comment. Okay. Thank you, and thank you very much for that question. We do appreciate it. First, starting with a compliment and a thank you for all the help that that you and your staff are providing in the community. The general topic area is that of plasma donations and a shortage of plasma, specifically from people who've already had COVID. Because that can be studied, as I understand it. I'm off script now at this point. Hoping you could speak to that, and also maybe a more nuanced question within there. How is the concerted effort to contact those people that may have had COVID? Is that something that's done on a regional level, a national level? Is that part of contact tracing through a local health department? Is that something your hospital might be involved in? Please, if you could.
So I think that, we're still learning about COVID and recovery paths for folks, right? So there is science that supports that plasma can help. I do believe there's a shortage. I think, first of all, many people who have recovered perhaps don't realize that they could potentially donate. And so I would encourage them to reach out to their local blood bank in order to learn more about that. We're not tracing it from our perspective. We're so busy trying to manage to the needs in front of us. I do know that we do have some blood shortages and plasma shortages in our region right now. And I think part of that's because, again, people are a little bit nervous to go to those places where they would normally go in order to have their donation taken. So we would encourage folks to do that as well. I know that they typically have at least a couple a month here in our local community, but we are seeing some shortages. In terms of the actual plasma and how to recover, listen, I'm not a doctor. I'm an administrator, and so I would hesitate to give any advice about how and when folks should be leveraging that. I would just encourage you to work with your provider. If you have COVID and that's something they believe would help you, they're looking at every possible solution to be able to help people recover from this illness. And so just work with your provider in order to figure out the right care plan for you.
All right, Angelia Foster, our guest. She is the Chief Administrative Officer with Marshfield Medical Center, Beaver Dam. They're hovering around that 90% capacity rate. The urging here is for people out in the community to show a little bit of respect for those healthcare heroes out there and wear a mask. Keep in mind this Thanksgiving, social distancing, maybe not getting together with those extended relatives. Zoom virtual meetings, not unlike what Angelia and I are doing right now, might be the best way. As she said, look back years from now at that one Thanksgiving where things were a little different. 920-885-4446 is the phone number. We're happy to take your questions here after the break when we return on Community Comment with Angelia Foster.